and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now, many of you have contacted me requesting that I do an episode on stroke as a result of the coronavirus. Now, for starters, if you have not seen my episode on acupuncture, the coronavirus, and the blood vessels, please watch it when you get a moment to gain a more thorough understanding of some of the things I will cover in this episode. Now, several of my viewers have expressed huge concern regarding the fact that a virus can cause someone to have a stroke. I myself have learned that there are individuals as young as 30 years of age who've been infected with this virus and have experienced a stroke. Now, as I've stated in my episode on how this virus affects the blood vessels, although this virus is seen as a lung infection, it has been discovered that this virus can cause blood clots that can lead to severe stroke. Now, there are healthcare professionals who have noticed this occurrence in patients who have had very little to no symptoms. This virus causes microthrombi, which are small clots that in some cases travel to the lungs or brain and obstruct the flow of blood. Now, there have been reports of blood clots having been discovered in various organs throughout the body. That's because this virus utilizes a specific cell receptor called ACE2 receptors to launch its attack, whereas these receptors are located in many organs such as the lungs, the heart, stomach, kidneys, and so forth. Now, when this virus binds to these receptors in the walls of your blood vessels, the blood vessels become inflamed, which can lead to clotting. Now, once a clot is formed, it can travel to the brain and cause a stroke. Now, symptoms in which you should look out for would be loss of sensation or paralysis in the extremities on one side of the body, speech impairment, and drooping of one side of your face. Now, it has been discovered that this virus causes severe inflammation throughout the body, increasing the risk of fatty plaque buildup and blood vessels rupturing, which can lead to stroke. Also, take a minute to view my episode on acupuncture, the coronavirus, and the flu, because with the coming flu season, you should also be aware as to how influenza can be associated with an increased risk of plaque ruptures as well. Now, the follow-up question I've received from all of this is, how would I as an acupuncturist diagnose and treat someone who has had a stroke as a result of being infected by this virus? Now, from a traditional Chinese medicine standpoint, having a stroke can be the result of multiple pathogenesis, which would include qi and blood deficiency, as well as disharmony of the liver and kidney and the heart. Now, the root cause of this deficiency can be complicated by overindulgence in a variation of things, such as alcohol, smoking, unhealthy relationships, or things that can lead to negative emotional stimulation. The complication of these factors can lead a practitioner to diagnose a patient as having deficiency below with excess above. An example of this would be liver and kidney yin deficiency, whereby in Chinese medicine, the liver and kidney are located in the lower third of the body, with hyperactive liver yang, where a person would feel a lot of energy combined with phlegm rushing up to the head to obstruct the channels and the collaterals, which would thereby induce stroke. Now, in critical cases, yin and yang would disconnect, which would result in a very poor outcome. Now, overall, I would have to determine whether there's a channel involvement or an organ involvement, then move forward to put together a treatment principle. If it's a channel involvement, it would either be a case of exterior wind invading into the unconsolidated channels. In that case, I would dispel wind, nourish the blood, and unblock the channels. Or it could be wind yang disturbing upwards with liver and kidney yin deficiency, whereby in that case, I would nourish the yin, subdue the yang, extinguish wind, and unblock the channels. If it's an organ involvement, it would be either heat type of closed disorder, in which case I would clear heat from the liver, extinguish wind, and open the orifice, or it could be cold type closed disorder. in which case I would resolve phlegm, extinguish wind, and open orifices, or it could be a bending disorder. Now, in which case, I would augment the chi, revive the yang, consolidate the collapse, and so forth. Now, in the acute phase of my treatment principle, I would look to expel any pathogenic factors involved, open up the orifices, and awaken the shin if there was a loss of consciousness. In the recovery phase of my treatment principle, which would be, as I've stated, a deficiency below with excess above, I would nourish the righteous chi of the body with acupuncture and herbs to expel the pathogenic factor. Those are some of the ways in which I would approach the case of a stroke patient, whether they'd experienced a stroke as a result of the coronavirus or not. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?